We want to take this opportunity and appreciate our invitation to this very important event. And we want to say we are celebrating this event at a time when we are faced by a global human, economic, and social crisis, and which is posing a lot of stress into the public health systems, into the food systems, and into the world of work. It is killing our people. It is causing suffering to our people. And more of our people are being pushed into extreme poverty. It has been observed that it has been noted that more and more of our people are going to be undernourished. Some enterprises have often found it hard to meet OSH requirements because they lack the resource to adapt to the threats posed by this pandemic. The pandemic is not only impacting on the quantity of jobs, but also it is impacting on the quality of the jobs. Many workplaces have been sources of the outbreaks, particularly when staff are put in closed environments and in some instances in close proximity to each other. In terms of our health impact in respect to this pandemic, the pressures and risks facing healthcare workers during this pandemic have taken a toll in their mental health. 1 in 5 healthcare workers have suffered depression, have suffered stress. And we want therefore to congratulate and salute our workers who have used their bodies as shield because they lacked any safety mechanism as they fought with this pandemic. We are talking of 7,000 healthcare workers who have died in Africa. And in Swaziland, the infection rate is at 5%. In the context of weak social protection programs, in Africa, it is expected that 29 million people will be pushed into extreme poverty. Most countries lack the fiscal space to respond due to low levels of domestic resource mobilization, volatile commodity prices, and high illicit financial outflows and capital flight. This has caused workers to resort to negative coping mechanisms such as sale of assets and predatory loans. Many of them have been forced to continue to work in unsafe conditions, thus exposing themselves and their families to additional risks. Without the means to earn an income during the lockdowns, many were unable to feed themselves and their families. For most, no income means no food. As breadwinners lose jobs, fall ill, and die, many are under threat. Most workers have lost their paid leave notice period and severance pay. Food services, retail industry, entertainment industry, transport industry, and the hospitality industry. Workers' income in those sectors have dropped by 15%. Domestic workers and secretaries in schools have gone months without income. Factory workers have not been protected in terms of screening, social distance, sanitizing, and mask. Violence and harassment has been the order of the day, while workers make demands for PPE and safety measures. We want to recommend a strong, resilient occupational safety and health environment that we consider it to be more vital for crisis recovery and prevention. We call on the government to enforce anti-hoarding and exaggeration of prices, in particular on food and other essential goods. We must scale up measures to protect livelihood, including through loans, guarantees, and tax breaks for businesses to self-employment and enterprises. We must increase medical personnel capacity for them to be able to deal with the pandemic. We must improve on testing capacities, access to medical supplies, and participation in vaccine treatment and research. Support mechanisms that may include food relief initiatives, what some call it food banks, and school meals, and support for employment retention and recovery. Saving lives should include extending social protection towards universal health coverage, income support, unemployment insurance, and we call upon that we re-engage the debate on minimum wage. Better national occupational safety and health policies, regulatory frameworks that are integrated into crisis response plans should include even environmental cleanups, well-ventilated spaces, disinfection of surfaces. We call upon support for labor-intensive sectors, workers and households facing job losses and income. Legal provisions for workers who have contracted the virus through occupational exposure to receive compensation. It is the right of workers to be provided with PPE by employers. And we want to say, Chairperson, as a federation, we are more than willing to partner with the government and employers as we all seek to address this phenomenon and the challenges that are facing us as a nation and the challenges that are facing us as workers in the field of work. Thank you very much.
Siyabonga kakhulu Bheki Mamba, siyabonga Ndvuleni submission yakho. Ema entities la fanana nabo Tukoswa, you will even sense the tone because they represent the voice of the membership, which is the sentiments that are being shared. This is how we are affected, and probably which is why even the submission was not rushed. The fortunate thing, according to my perspective, is that the submissions are being made against a backdrop of a very powerful theme: anticipate, prepare, respond to crisis. We will all remember that when COVID-19 hit the world and Eswatini,